a promise to the American people to take care of you if you're having problems financially or if you're having an issue because you were older and needed health care. And it changed the country in a good way for many reasons. But we're all in it together, Stuart, which means we'll be there for you, the American people, when you need help with Medicaid and Medicare. But you've got to stay healthy as well. Be vital. Do the most you can do to really live up to the potential, your God-given potential to live a full and healthy life. And, don't eat carrot cake. Eat real food.
That's what you've given me.
I know. This is a little bit of a wink, but I was jokingly calling this the Maha Medicake. But of course, I couldn't find a healthy cake, so I bought the closest thing, a carrot cake.
We'll just leave it right there. We'll take care of it.
I'm sure you will.
Hi, my name is Dr. Rubin, and don't listen to what Dr. Oz just said. I know he was saying it in a joking way, but if you want to have carrot cake, you can have carrot cake. There is a problem in this country with shaming people for their food choices when you don't necessarily know what is going on with the other person. I'm going to tell you a story to highlight this. When I was going between college and medical school, I had 6 months off because I graduated early where I was putting on medical educational programs at a public magnet high school in Cleveland, Ohio. So for one of those programs, the principal of the high school had bought a bunch of pizzas to feed the kids in between some of the lessons. And I saw one of the students taking slices of pizza and putting it in their pants pocket. And I went up to them to ask them if they were okay. And this student told me that they got extra slices that they were going to take home to feed their siblings because they weren't sure if their siblings were going to have a meal that day. Did you know that about 13 million children in the United States have food insecurity, meaning they don't necessarily know if they're going to be able to eat for their next meal? This is a significant problem in this country, and a lot of the focus has been taken off of that issue and other related things, and we're focusing it on personal choices and putting the shame and blame on people when really there's a lot of systemic problems with our ability to have good access to nutrition, which really bothers me because I practice pediatrics and allergy immunology, so I take care of a lot of kids, but also from the lens of food allergies. And children who are disadvantaged, who have food allergies, have a really especially tough time getting access to not only healthy food, but safe food. So we really need to be able to look at this situation and try to help improve the health of everybody. But by shaming people for saying, don't eat carrot cake, that's not helpful.